And welcome back to JKLIVE here at Citizen Television on the bench with the newly elected or nominated, selected cabinet secretary appointed.
No. I was appointed the minister, so it was just a reshuffle was done.
Speaking of reshuffles, Waziri, there's been so many in the last 3 years. I mean, it's almost dizzying. This cannot be not healthy.
No, it's very healthy. The president, if you see, even in corporates, for example, banks, you can only serve for 3-4 years.
But you haven't even done that.
No, I mean, you look at President Kibaki and President Uhuru and all that. Reorganization, they're not called reshuffle. Reorganization, I mean, some left, Uturi left. Some new, the gender minister was appointed afresh. So I was the only one, I think, who was reshuffled this time.
You?
I think I'm the only one who left his ministry. Muturi was replaced, Muturi was replaced, and then there was the position of the gender minister was filled.
Yeah. And before that, the impeachment.
Of?
Who else? Who's now a thorn in the side of government?
No. You know, the president went to Mount Kenya, just like any other part of the country. He confirmed that the mountain is still intact for him. 2, he launched previous projects of the previous administration and new ones. Today, coffee farmers in Mount Kenya, I think since independence, they have the best prices because of the good policies President Ruto's government has put in place. I really want to thank the previous minister and the current minister for the good work they did. The president promised the people of Kenya a model called bottom-up economic transformation. SHA is bottom-up. Hustler Fund is bottom-up. Name it, fertilizer farmers is bottom-up.
Fertilizer farmers who were supposed to be given a grant by Russia for free fertilizer, which was
you don't engage me on propaganda, you know.
You see that's propaganda?
Yeah, let me tell you. Rigiji, my very good friend, and I have a good respect for him, told us the president cannot go to Mount Kenya. And he can't touch the mountain. All of us. The president, when there are 5 days, unoccupied. Rigiji should go back to Mount Kenya and do the circle the president did. He should not just become a propagandist on a TV station that's unable to pay his staff. No. And you looked at the way you're questioning me.
Yes.
You look at that gentleman who was there. He should have just left the mic for Rigiji to speak for 3 hours and then
come back.
And then come back. He was never asking him a question. I mean, if you call me, I'm not going to that kind of a show.
No.
I want a show where you are asking me very critical. The people watching us, they know you're asking me very serious questions.
Correct.
So, William Ruto has a social contract with the people of Kenya.
Yeah.
And he has a debt, inshallah, he has a debt with the people of Kenya on 2027.
And tell me something, Murima, you think they accepted him? You think he got what he was looking for?
Absolutely. I mean, look at the perception. We are being told the president cannot go to Murima. He can't even, don't touch the Murima.
Lakini kuna watu walilipwa?
No, but that's again the propagandist. That's fake news. It's like you tell me if I go to Wajir and I see elders and you tell me I've paid.
Yeah.
No. The president went particularly to Nyeri. How many times? He started with Nyeri and he finished with Nyeri, Odaya Hospital. And he addressed the women of Madira.
Yes.
Just 5 kilometers from the home of the deputy president. But having said that...
This is Rigiji's backyard.
Yes. Having said that, the president has a contract with the people of Kenya, unlike any of these other politicians. And he has a date with the people. Inshallah, 2027. That's scorecard. One of them being universal health care, Taifa care, which we will do whatever it takes. Now it's about 48, 50%. By Friday, we will announce the new CEO of SHA.
Okay.
And the directors.
Oh.
Yeah? We are going to look at the other stuff. We'll give them very priority. We must sort out.
And the strikes, the
unions.
Yeah, the unions.
I have met the leadership of the health workers, particularly the UHC. I met the leaders in my boardroom. I walked with them to the rest. I asked them to give me 3 weeks. Monday, I'm meeting the leadership of the Council of Governors and the Health Committee of the Council of Governors. I will discuss with the unions. I will discuss with the Parliamentary Committee on Health. I will discuss with my boss. For universal health care to work, we must solve union issues, the HR issues. Tomorrow at 10:30, I am meeting the Kenya Medical KMDU union at 10:30. I will listen to them. They have two issues. One is the internship. The internship now, the only issue we are discussing is the amount of money to be paid. They want 206. We said 70. A dialogue. It's good to talk. We will come somewhere. The other one is the CB of 2017. We will discuss. And we will involve the county government because health is devolved. I think if all of us, the stakeholders in this space, generally sit on one table, and we put the interests of the country above our different interests, we will, and make sure that universal health care works and Taifa care works, then Kenya will be a great country where a model. A good example, this universal health care, one of the best countries is Thailand. In the last government, all the health ministers used to go to Thailand for benchmarking. Until the Minister for Health came here from Thailand and said, please don't come back to our country. You're only benchmarking, you're not implementing. So even me, I don't want to go there. I will only go there after I've implemented. Inshallah.
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 Listen, what do you think of this broad-based government? Because some of your former opposition leaders are now holding portfolios. They're in cabinet with you. Former opposition leaders. Does that make sense?
For the stability and for the delivery of key projects that are important to the citizens is good, all of us. Why am I saying? Azimio had universal health care coverage. Azimio in their manifesto had affordable housing. Okay? Azimio in their manifesto had something similar to Hustler Fund. We had the same thing. Elections are over. We are all the leaders of Kenya. Government is enough for us. What is wrong if we agree on the implementation of policies and programs that are good to the people of Kenya, and when the election comes, we can have our different positions. So for the unity, do you see any more mandamanos? I mean, we must even, for investor confidence, you want the country to be stable. So for the stability, you see, for things to move nicely in Parliament with a very good oversight done by parliamentarians, then all of us leaders, whether we're in the opposition, whether we're in government, whether we are in the private sector, we are all working for the betterment of our nation and for the betterment of our citizens.
But now there's no such thing as an opposition. It doesn't exist. Unless you want to call Kalonzo and Eugene and, you know, the other, and Martha Karua.
But what are they? They're opposition. Unless you don't believe in them.
None of them are in government.
But so they should play the role of oversight as the opposition. They must give an alternative to government.
So Baba is no longer opposition?
Baba says he's in the opposition. He has only, like football, he has given us some few players. Very competent, by the way. I worked with the Minister Bandi, I've worked with the Minister Joho, I've worked with the Minister Wandai. Oparanya. And in the 10th and 9th Parliament, and my colleagues from the other side, Minister Kagwe, Minister Liki Nyanjui. I think it's good to have a cabinet that has all the shades of the people of Kenya, regardless of their political orientation.
Yeah, lakini one day kikiumana and they all walk out, what do you do?
Who will walk out?
The so-called opposition.
Let me tell you, the same people who are now doing propaganda and fake news, it's only the players have changed. It's the same thing people were doing to Deputy President, President Ruto when he was a deputy.
So you're saying same monkeys, different trees?
No. I mean, the people who are insulting, the people who are saying all bad things about William Ruto when he was a deputy president, are the same people who are calling media houses, press conferences in dingy corners, talking about William Ruto. William Ruto is focused. As I told you, he has a plan to implement, working with his cabinet, principal secretaries, the rest of government, to deliver on the covenant, on the contract, social contract he has with the people of Kenya. And the date will be 2027 to decide. If we implement universal health care, Taifa Care, William Ruto, 60% of the election is done.
You're good friends with him, aren't you? You're buddies.
No, now he's a president. We're no longer buddies.
But you drink tea every time you're in the neighborhood.
We're lucky we drink tea. We don't drink anything else. Imagine if we were drinking
something else.
Yes. We drink tea.
Okay.
Yeah.
that one, I believe you. Very many tweets, Waziri, on the magic wall. Let's go to them real quick. Lots of feedback, plenty of feedback. Let's go first to Mark Makuda. He says, if mortality rate is high due to negligence and counterfeit drugs, who is sleeping on the job? Who should take responsibility?
The regulatory authorities.
Is that poisons and thingy
board?
Or
the labs and even our health workers. If an incident in a month, for example, if there are 10 mortality incidents in a hospital, I mean...
There's negligence.
The regulatory arm of the Ministry of Health must deal with...
Yeah, but nobody bothers, Waziri, you know that. Nobody bothers.
I am there. But now we are doing very well. The report we received today, Kenya's maternal mortality rate is very high. And an announcement will be within the course of the week.
This is Dr. Mapangala. He says Kenya has a doctor-to-population ratio far below the recommended levels. How come you don't put this into consideration while budgeting?
I agree. I mean, one of the reasons we are producing more medical, particularly doctors, because remember, we only had 2 universities. Now we have 13 universities training medical doctors. Still, we have not reached the ratio that Dr. is saying. So that is why the Taifa Care, one of the key components to resolve is training the HR component of our healthcare workers, from training to solving union disputes, making sure there's movement, there's promotion, and all that, working with the county government.
Okay. V. Nyakundi says, why must we register for SHIF to access healthcare? Yet health is a basic right. Shouldn't essential health services be available to all without mandatory registration?
Healthcare, primary healthcare is free. But there must be records. When you walk to a doctor, there must be your name, there must be a number. So why I want to ask Nyakundi, why do you want to hide your identification? And that's why we want to have health data sharing across all sectors in the country. than what happens in developed countries.
Is that going to happen?
It's going to happen. That's what I'm telling you. You will never see Kenyans carrying. It will be paperless. In fact, sure, you will not even have a card.
You just you walk in with your fingerprints?
Your fingerprints, yes. It will be paperless.
Give me a timeline.
Even now, we are going to these counties. Once you register, there's no card you'll be given. We are only giving temporary cards, mark my word, to Kenyans who don't have ID cards.
What if there's no power? What if there's no electricity?
We are using backups of solar.
You have all the answers, don't you? Bandage Blue says, as a medical intern, I have been at home for over a year now since graduation. What is the CS, Honorable Duale, planning to cook for us? Our knowledge is decaying too fast.
I think about 40 of the interns were outside Afia House yesterday. They brought a petition. Number one, we can only post interns in the month of July.
Why?
But the reason is all the facilities have interns. So they have to leave. A space must be created. So they have agreed that July we will post them, about 4,000. Balloting will start, which they asked. Balloting of where people will go will start in the next 3 weeks. But we want to increase the number of facilities that can host more interns. Because the number we are producing and the number of facilities registered for interns is not in tandem. So we need to have more facilities that can absorb more interns.
How long is the usual internship?
About a year.
About a year. Okay. Next. This is Mark Makuda again saying, if mortality rate is high due to we saw this, didn't we? Kenya Mtemi says, Jeff, ask Honorable Duale if SHA will work for outpatient like NHIF did.
Yes. Yes.
Done.
Done.
Anonymous says, this is from the police. I can say that this for a fact. There's a crisis. We cannot access healthcare from any hospital of our choice. The only facility we are attending to is Bliss. Can the CS address this?
I have said that in a period you're working with the Public Service Ministry and the Ministry of Interior, the police will be integrated into this system where they can access services at any facility across the country where they are stationed. Yes.
Anyway.
That I can assure you, because the police are everywhere.
Yes.
Yeah, so they must access. They can't be subjected to one facility.
Correct.
Yes.
Silas Usaba says, a lot is happening in the maternity sector. What are his plans? There are cases of young mothers losing their children due to negligence. You talked about that.
I talked about that. Yeah.
And that's going to be addressed.
About the mortality rate. You know, it's like a mother walks to a hospital to come out when she's very happy. Or it's just like you want to donate kidney for me, and ultimately you die, and you are very healthy. Those kind of negligence, I think the regulators, and I'm meeting them next week, that should not happen again. And there are people who are concerned, there are institutions concerned to make sure this kind of negligence doesn't happen.
This is, hey, little brother. He says, please ask my uncle Duale, what's the fate of UHC staff who were discriminated since 2020 during COVID-19 under the punitive UHC contract? We demand PNP terms, payment of our 5 years gratuity and remittance of our NSSF for the last 5 years.
I met their leaders last week. We have agreed to resolve this, but this is not for me to resolve. I have to sit with the Council of Governors. They work at the counties. They have signed the contract with the county governments, and we will only, and this must be very clear, the county government will give us a list of those who are working in the counties. Respect the counties. The money we have in the Ministry of Health will no longer be there. I will transfer that money to the counties. But first, we must get out of the UHC staff
You said you met them last week.
Yeah, I met the leadership. I addressed them.
You've been at work 9 days.
No, I met them. You know, let me ask you a question. If you're told there are people making noise outside your house, will you go and sleep?
No.
I came out and I addressed them, and they were very happy. And they gave me, I asked for 3 weeks.
3 weeks?
Yes, on Monday I'm meeting the Council of Governors because they're a very important organ, because they are the staff at the counties.
Yeah. Kivuva John says, 1, what are the 2 projects, given an opportunity, you would undertake for NFDs? And 2, how will you deal with substandard and expired drugs released into the Kenyan market? I think you addressed the second one, right? There's plenty of...
NFD, that's what? On the frontier district?
I think so.
That is a road from Modogashe to Mandera, which is going on.
Yes.
Even though people mocked. If that is done, the people of northern Kenya, if that corridor is done, not only for northern Kenya, we will kill the sessional paper number 6 that says only the highlands, the productive areas of our country, shall be developed.
Yeah.
Secondly, then power to reach Mandera, Wajir, they're suffering. Those are the 2 key priorities, among many others.
It's going to happen?
It's going to happen. The road is... take a camera. The people whom were mocking the president, when he said from Elwak to...
Correct.
I wish them, they should go to Modogashe. All the sections are... the bulldozers and the tractors are there.
Wow. Okay, Kiprop SK says, what systems are in place to tackle illegal donkey bush slaughter and uninspected meat sales? This poses a public health risk and a gateway for zoonotic diseases. How is MOH ensuring food safety for Kenyans?
I think I agree. Public health is very critical, and there's a whole state department in the Ministry of Health. And now we are grappling with Kalaza in about 4 counties in the north. We are grappling with cholera. We've lost 6 people. Yeah. Our teams are in the counties working and supporting the county health teams. We're grappling with the mpox. We have just received tonight, my PS is at the airport with all the other partners. We have received 10,700 vaccines. And I agree, this is the public health department must work with the Ministry of Livestock to make sure that illegal donkey bush slaughter is stopped. And we know the ones who are doing.
You do?
I mean, the Chinese, and it's a delicacy in China, so we must stop it.
Yeah.
Yeah. And of course, working with the security sector.
Because sometimes people here come in and they want to carry heavy loads. It's like they've been eating donkey meat and they feel like carrying.
Make sure you don't eat samosa in the street. You have to know what type of samosa you're eating, my friend.
Yes. Listen, this cholera, is it being contained?
Yes, it's being contained. In 4 counties, Nairobi, Kisumu, Migori, and Homa Bay.
Yeah.
We're containing.
What's the warning? Wash your hands and don't eat.
Wash your hands. Make sure that you protect yourself. You wash your hands. You look at the sanitation. And the county governments, our teams are doing very well. In Kalaza, we have sent a number of mobile clinics to help the county government do. And next week, we are launching 47 vehicles to the 47 counties to deal with disease surveillance.
Where are you getting all this money from?
The Kenyan taxpayers. And they're entitled to affordable, accessible, and equitable healthcare.
The Alchemist Kenya says, kindly ask Duale, when was the last time doctors were recruited? I see police officers, teachers, military being recruited, but no healthcare workers in the same magnitude as teachers or police officers.
Teachers and doctors are not recruited in the stadiums, like or sub-counties like the police and the military. Counties recruit every day. I'll ask Alchemists to watch even the papers tomorrow. There might be a county recruiting healthcare providers.
Oh.
Yeah.
Okay, so you're giving them a tip. Is that what you're doing?
Yes.
All right, Alchemist. Onsongo Timothy says, 1, alisema atapeana list ya Al-Shabaab financiers. What happened? Number 2, benefits of SHA on cancer patients.
For the first time, preventive healthcare, cancer patients can access for free screening.
Free?
Free. The government of Kenya is paying. You know, preventive was not catered for under the former NHIF. But under Taifa Care, preventive is very important. It's good to have preventive strategies before you go to curative. On the Al-Shabaab, I think he's in the old history. He's very pedestrian. He looked for another question for me, and I think he just found this only one. Tell him that number, like Muturi. That number will not dial.
It's the wrong number.
It's the wrong number.
Joey Kenneth says, my mom's due surgery was declined by SHA this week despite paying all 2025 premiums because there's a directive to decline all surgeries of above 200,000 shillings. Where does SHA work?
You should tell us which hospital, and you should tell us which hospital, which health facility, and I'll take it personally.
How can you get in touch?
I'll get this email. Hassan should get that email.
Hassan, are you looking?
Get that email.
At Ajowi.
Ajowi, we will communicate with him tomorrow morning. You should tell us the facility, and we will, SHA will reply to him.
Hassan at Ajowi_Ken.
And even him, he can dial our call center 147.
Number 147?
Yes, and the waiting period is 20 seconds.
Huh?
20 seconds.
I'm going to try.
Try it tonight. Well done, Safaricom. The lead consortium.
It's Kipleting says Kenyans have raised a lot of concerns on dysfunctionality of SHA. All problems in the defunct NHIF were transferred to the SHA and Taifa Care. How do we believe in SHA when we have many cries and complaints?
That is very general. Go to 147, raise your complaints, and raise all the cries. We are solution makers. We look for problems. So get that email. We will send him, and he can go to 147.
RK says, if I may ask, what qualifies one for a cabinet secretary position in Kenya?
The Constitution. You should read the Constitution. The qualifications are in the Constitution.
Yes.
And the removal are in the Constitution.
Yes.
Yes. And any Kenyan can be a cabinet secretary. And that's why those of us who have the opportunity, the privilege to serve the country, we are not better than the 50 million plus people. So we must work for the people.
But you must be above privilege. You have 4 ministries in 3 years.
No, 3.
Well,
3.
Defense.
It's not a privilege.
Defense
it's
twice.
Hectic, my friend. It's hectic.
Huh?
It's hectic.
Come on. Do you look stressed?
It's very subjective.
Gabi Wakasiaka says...
The emails are coming.
They're coming thick and fast. Please, Honorable Duale, Kenya's health sector has endured years of dysfunction, corruption, and inefficiencies. Kindly, Bwana CS, restore accountability and efficiency that will ensure quality healthcare reaches every Kenyan who depends on it.
This is a very true Kenyan.
Huh?
This Gabi is a true Kenyan.
Wakasiaka.
And if he's watching me, I commit to the people of Kenya that we will deliver a healthcare that is accessible, that's affordable, that is equitable, and we will deal with the corruption at the Ministry of Health.
You promise us?
I promise you.
Even if it kills you?
Of course, the time when I'll die, that it's God who decides. It's not the cartel. I don't freak, my friend, you know that.
I know you're not afraid.
Yeah, I'm not afraid. My time is decided, the destiny is decided by the Almighty Allah. Cartels can do whatever they want to do. It is the president and the deputy president and the people of Kenya that I'll listen to. But I agree with him. There's a lot of inefficiency. NHIF was full of bureaucratic, it was faulty,
Corrupt.
it was corrupt, full of fraud, and the people who are fighting, there are people who are getting millions of shillings.
If not billions.
If not billions, by using the three finger.
Jesus.
I am telling you, this is real. Jeff Koinange is admitted and he's here at the bench.
My 7 fingers are there?
Yes. Though they use your 3 fingers.
Oh, they use my 3.
And they put you in hospital for not more than 7 days.
Because?
There's a guy who did knee transplant 10 times in a month. We know yes, we know the facility, we know the name. If push come to the shove, we will name and there are agencies that can investigate.
All right, Waziri, you've got a couple more minutes. You have a chance to address the nation 9 days into your role, into your job. And a lot of, you saw...
I really want to ask one thing.
Go on.
One thing. Because health is devolved. I really want to ask my colleagues, the governors, the health sector professionals, the facility owners, whether they're faith-based, whether they're private, and us public, the regulators, all stakeholders within the health sector. Our aim and our mission should be for the delivery of a seamless system of Taifa care. I am ready to meet and listen and learn from everybody within this sector. And anybody who puts a block, some people call me the bulldozer. Bulldozers don't destroy buildings. They remove the debris. I'll remove the debris. I'll clear the way, and I'll clear space for healthcare to work.
That's it.
And I pray to God that me, with all the people in the health sector, we forget our personal interests and we put the nation's interests. As I told you, the prosperity of any nation is measured by the health care or the health of its citizens.
And right now, this nation is in the ICU.
It's not in the ICU, but we have serious challenge that I think other governments could not face it, but I think this administration, under the leadership of President Ruto, we will. And please tell those who are making a lot of noise that, when I'm in government, a good leader, when I'm in government, like tonight, when I'm here, I have the right to refuse to sign something, okay? I have a right to voice my concern. And it's very sad to demean leaders. Rigiji should stop demeaning ministers. I can today give the people of Kenya 10 things I did at the Ministry of Defense. I can give the people of Kenya 10 things I did at the Ministry of Environment, Climate Change and Forestry. I can give the people of Kenya, and the Ministry of Health workers are looking at me, 4 things or 2 things that I have done since I landed at Afi House. I want the former Deputy President to tell the people of Kenya 10 things that he did in the 2.5 years he was in government. I'm challenging him tonight. Has he ever been here?
No.
To defend government?
No.
Have you ever seen him anywhere?
Only in Inoro.
So he should not demean ministers. He should not demean leaders, whether they're MCS, maybe, MPs.
Yeah, maybe he wanted his 10 billion back.
He asked for 10 billion. I don't know the rationale, how he calculated 10 billion. 10 billion is a lot of money. It can do about 240 boreholes. Can you imagine?
Is that a true story?
Very true story.
He demanded 10B.
B. I was aware. And I think the president had to say it because he was pushed to the wall. You cannot call yourself the truthful man. I mean, the other day, he's a guy who abhors a community. And last night he was saying, the people of Mountain cannot live without a Somali community. No, that is wrong. All communities in our country are important. Whether in the mountain, in the desert, in the rift, in the lake, in the ocean, in the urban centers, in the slums, all cities, there's no animal farm in Kenya. And that's what the President Ruto's agenda is, to unite the country regardless of where we come from, the religion we profess. That's why, but I think the last thing I also want to do is, as leaders, let's not create a culture of violence. And I think the Inspector General and the people who are in charge of security sector, they are under duty to make sure that violence does not take place in our country. Everybody should have his piece to say. If I transport goons myself in my function, the police must be there to deal with my goons. Yeah.
And you?
Even me.
Who brought the goons?
Yeah, whether it was whoever brought it, whether it is the person who was in that church, and particularly, let us respect the house of God. Places of worship. Yes. And I want to ask my good Christians, let them learn from our Muslim brothers and sisters. When I go to Jamia, sometimes I pray on the street. Because I have no special place. It's too full. No, yeah. There's no special place for a minister. If I want to sit in the front seat, I should come 5 hours. So you're outside? Yes, and I cannot be given to address in the mosque. No. No. Even if I'm given, I won't. Because I don't want to address from the house of God. So I think we must not allow, and this is to the IG, a man I have a lot of respect for. He's capable, him and his 2 deputies. And we must also respect the men and women who run our security sector. We must respect them. Absolutely. Yes. Well, Waziri, but political leaders should not be allowed to perpetuate violence. Waziri, we hope, regardless of their status. Sure. Waziri, we hope you last long enough in health ministry. Please advise the president. At least I finished universal health care. You finished that one? That one, if I finish, I'm ready to leave health. Yes. You're ready to go to sports or water or, you know? No, sports, if I'm taking it, I will go, but I no, I don't want to go further. My colleague is watching me. But I can serve anywhere for the benefit of the people of Kenya. Right. Yes. I was their first majority leader, so... Correct. I was the Deputy Minister for Livestock under President Kibaki's government and Prime Minister during the Grand Coalition. I served as a ranking member. I can go and look after my camels. Yeah. The way you have a coffee farm, I have a camel. I can go and write another book. Exactly. I mean, life is not static. It's not static. Absolutely. Yeah. Well done. Yeah. Well done. Waziri, good to see you. Good to see you, Jeff. I'm so happy. And thanks so much for staying up this late. We appreciate it. Always. And thanks so much for watching, folks. You know, if it's Wednesday, it's all about those 3 letters on the keyboard that follow each other. JKL. Thanks so much for this conversation. Thanks for your comments and your questions. Keep them coming at Koinange Jeff, at Citizen TV Kenya. Hashtag is just Jeff JKLIVE. We'll see you again next week, same time, same place. Good night. Good luck. God bless you all. Inshallah.